Thank you, Mayor, and good morning. This is another step forward in our efforts as a region to try and beat back, confront, and protect the public from COVID-19. And I want to thank the mayor who is here. I want to thank the members of the City Council. I want to thank all the medical folks who are here, who for the last year and a half have got up every single day and looked for every possible way we can save lives and protect our community, protect our economy. This morning I dropped off my kids for their first day at school. Everything we're doing here is designed to give us as much of our life back, keeping our kids in school, keeping our economy going, and saving lives, fighting to save lives and protect our communities. And so I appreciate everyone who is here today. This is another part of our efforts to protect the integrity of our healthcare system, to share resources that are out there and available, and continue to drive forward collaboratively working together. We're here today to reinforce this effort, adding another monoclonal antibody regional center to our region's portfolio. As the mayor mentioned, these monoclonal antibodies are another great example of ways that science and medicine can help protect us. And we have to trust and believe and know that these efforts work. We're standing here today surrounded by doctors, Dr. Wooten, Dr. Tudor, Dr. McDonald, so many others who are here today who have taken an oath to save lives. And these antibody treatments are another thing that, by trusting the medical community, by trusting your doctor, it's something that can help save lives. It can help people with mild to moderate cases of COVID who are at risk of moving to a more severe form of COVID. And the treatment can kick in very rapidly. This center and the work that's been done here and the teams of doctors and nurses who will administer these are helping, again, build our capacity. Today is also another example of our city and our county working together, collaboratively. When Mayor Gloria got into office, I knew the city-county relationship would be stronger than ever, not just in our communication and our work together, but in the substantive steps we're taking, whether it be working together around housing or homelessness or transportation, or the continued efforts we're taking around COVID. And Mr. Mayor, we thank you. Our entire region benefits when our city and our county work together. To Council President Dr. Jennifer Campbell, thank you for your leadership in COVID. It is very nice to have a doctor as the leader of our city council. And Council Member Kate, thank you. It was very early, in the early days of the pandemic. Council Member Kate and I stood together in a bipartisan way to denounce the anti-Asian Pacific Islander insults and rhetoric that were coming, and we are grateful for all of those efforts. The county began the collaboration about 7 months ago around monoclonal antibody medication. The mayor, as soon as he got in, said, what can we do more in the city? And we're grateful for that. I also want to thank the members of the State Emergency Medical Services Authority who are here. Thank you for your partnership and your effort and the tremendous work that's been doing. Monoclonal Antibody Regional Centers have been open in multiple locations throughout the county. And we've done it with multiple healthcare partners, but we are incredibly thrilled that this site is coming online and coming online now, a time when we are seeing cases increase. Since February 9th, this life-saving treatment has been provided to more than 1,600 individuals in San Diego County, but this location at this time is much needed. And it is a great thing that we are adding. And so we want to thank again everyone for doing it, and we want to reiterate the importance for everyone out there. Don't wait until you get sick. Do everything you can to avoid it, and primary among those is get vaccinated. Vaccine is free, it is safe, it is effective, and we continue to urge that that is the single most important thing folks can do to protect themselves from COVID-19. With that, I'd like to introduce Dr. Wilma Wooten, our public health officer, to explain why early treatment with monoclonal antibodies is so important for our fight against COVID-19. And it is not an alternate to the vaccine, it is an augmentation and enhancement for individuals who may contract it.